Identify the green pointed structure. It is present in the posterior cranial fossa. For convenience, I have highlighted a sigmoid sinus on the posterior plane and inferior petrosal sinus in the anterior plane, and the red colored structure is the glossopharyngeal nerve. So what is this lightly the green pointed structure which is just behind the glossopharyngeal nerve? These are the rootlets of one nerve which joins together to form the cranial nerve, which vertically descends from the jugular foramen within the carotid sheath vertically downwards between the common carotid artery medially, or the carotid arterial system medially, and the internal jugular vein laterally. Coming downwards, it gives some laryngeal nerve, the superior laryngeal dividing into external and internal laryngeal nerve, and recurrent laryngeal nerve hooking across the arch of aorta on left side and subclavian vessel on the right side, descending on either side of the esophagus and entering through the esophageal hiatus of diaphragm, then forming a plexus to supply the heart, cardiac plexus, forming a plexus to supply the lungs, pulmonary plexus, forming a plexus on the esophagus to supply the esophagus, forming a plexus on the stomach and intestines to supply release acetylcholine throughout the body. And this pointed structure is supplying entire GAT up to the junction between the right 2/3 and the left 1/3 of transverse colon. It is traveling or wandering throughout the body, so therefore the name vagus nerve. Vagus nerve is one of the major or the longest cranial nerve in the body. It travels all the way throughout the GAT, supplying the gastrointestinal tract. It is a major parasympathetic nerve in the body. It acts via the acetylcholine receptor because the neurotransmitter released by this nerve is acetylcholine. Thank you for watching and learning from Logic Medico.